This is obviously a really critically important issue, and many of us have been working together. It hasn't been just me. We've had innumerable meetings. This was not something, as my good friend from Bakersfield said, this isn't something we thought we were going to work on this year, but it blew up when Madera Community Hospital closed right after Christmas, They had to give notice to their employees that they were moving into the red and that they might be laid off. And when that notice hit, people left. They needed to find a job. They needed to the doctors needed to figure out where they were going to be able to do their work, and all the rest of the staff was hoping to get out and to go somewhere else. So it's been a devastating impact on the community. 160,000 people, and the hospitals located near communities, that farm worker communities, where this is their primary access. So I want to make sure that I thank the governor and Dr. Ghali for their incredible work with not only the Senate, but also the Assembly in trying to craft some solutions, because this really is just an itty-bitty piece to get us through the next couple of months. What we know is that 7 or 8 hospitals are on the brink of closing after Madera Hospital. And some of those have made public statements about it, but some of them are trying to hold on and trying not to have what happened to Madera happen to them as well. And so this provides an opportunity, and every situation will be a little bit different, because some are public hospitals, some may be non-for-profit. The strategy is to try to help everybody. But the other part of it is that as we have met with every single constituency groups, what's really clear is we need a process for evaluating what drove that particular hospital near bankruptcy. What are the circumstances? And I won't talk about Madera because we don't have time here. But the bottom line is it was a set of circumstances, part of which was it was the private pay or the commercial underpayments that hurt them. In other words, it was the commercial covered individuals, which is what all of us are, right? We're all on commercial. The cities, the counties, special districts, the school districts, they have the insurance. And those patients went somewhere else. They went to the bigger cities and the bigger hospitals. And that left just a constituency where we don't, as was recorded before, where we don't pay enough in order for the hospital to succeed. And COVID has had an incredible impact as well. So my point here is this: look, this is the first step. It has been recommended that we create an oversight process very similar to what we do with our public education system. Is we send in FSMAT and they analyze a situation, they make recommendations, and sometimes it's recommendations that boards need to be replaced, CEOs have to be replaced, spending has to be reduced. It's a powerful tool that the state has used in a different context. And it's been recommended that we use that same kind of process over the long run so we can analyze what's going on and how can we make some better decisions and some improvements. And it may be changing what the hospital's doing. As my good friend from Bakersfield said, none of us have run a hospital before. We're not in a situation where we can do that. So number one is this is short-term loan. Number two, we're going to need longer-term loans or grants. Number three, there's an opportunity to do a FSMAT type process. And number four, the MCO tax that was discussed. All of those pieces need to come together, and we need to do it quickly. We have between now and August to get this right. And so this part of the puzzle pieces is really, really important. And so I want to thank our illustrious chair for all her work on this, negotiating with the Assembly and the governor's office. We can get this done, but let me put in a different emphasis on some of the things that have been said. This legislature made a commitment to try to cover as many Californians as possible. and we've been doing it in a responsible, incremental way. But we also need to change how the system works. And we need to drive people away from using the emergency room as a primary care provider and create opportunities, as many opportunities as possible, to get people good, high-quality health care at the lowest cost and the most efficient. And we are not there now. So this MCO tax, I think, creates an opportunity for us to make major investments in bringing new doctors on board, right, for some of our disadvantaged communities that have a lack of healthcare services, making sure we're also providing incentives for the allied workers that work in the same system. I mean, there's an opportunity here, and so any ideas, now's the time to pop them up and make sure they're on our radar screen, because we're looking to make fundamental changes in how we provide healthcare to our residents, and this provides the emergency that's got us all at the table. And we're not done yet, so I want to urge you to vote aye today and participate as we move forward. And I respectfully ask for your aye vote.